I'm Dr. Jen Johnson. Thanks for joining us on this lovely Sunday. For those of you that are joining on Facebook Live and also on this Zoom call, thanks for sharing with IVAPM-Live. And this month we have a really great topic, an interesting speaker, and a lot of discussion, I hope. If you're joining us watching this already recorded and you have questions, because you're watching earlier, please reach out to IVAPM at info@ivapm.org and we can get your questions answered by our speaker today, Dr. Danielle Anderson. Danielle is a member of the IVAPM board, a veterinarian from Ontario Veterinary College, has a rehabilitation practice in Ontario, and has a lot of great information about shared care, which I think is an interesting topic and really timely. Changes in veterinary medicine happening every day. So I am not going to chat forever, but I will be monitoring your questions. I'm excited to introduce Dr. Anderson this morning.
Hey, good afternoon, everybody. I'm not sure, Jen, you were a little glitchy, so I'm not sure how much of that came across to everybody else. So I am Danielle Anderson. I'm a veterinarian in Ontario, Canada. And so there's been a lot of changes up here, and, this is an international group, but I think it changes one place and it quickly starts filtering out into other places. And I know that shared care is not just an issue of concern in Ontario, but it's definitely all across Canada, in the States, and worldwide. I first sort of started getting involved with this a few years ago. I went to virtually attended the IAVRPT conference, and there was a lot of discussion around shared care between physiotherapists, chiropractors, massage therapists, technicians, everybody involved in rehabilitation. And so they came together to try and work on definitions and how this might look and moving forward. And so I actually left that group because it became more prominent in Ontario, and I wanted to try and make some changes locally. So I became involved with this about 3 years ago. So I do really want this to be interactive because I like to hear everybody's opinions and feedback on all of this stuff. It is dry, it's legislation. So anytime someone wants to interrupt with a question, please feel free to do so. And then we'll talk a little bit further. So I do have a referral rehab and pain management practice in Ontario. That's all I do. It's all I've been doing for at least 4 or 5 years. I left general practice just because we're that busy. So we know that it's really, really important to get shared care started because, there's all of these patients that need to be seen, and we need to make sure that there's enough places for them to go. All right. So the IAVRPT committee came up with this definition of rehabilitation. So let me know what your thoughts are. We really liked it. It was pretty all-encompassing. Animal physical rehabilitation is a multidisciplinary collaborative approach to the restoration, management, enhancement, and maintenance of physical function in an animal for optimal quality of life, maximized level of function, reduction of disability and pain, and prevention of injury. And that pretty much encompasses everything we do, right? Getting those dogs back to sport, conditioning them so that they don't get injuries when they're participating in sports, dogs that are coming post-surgery, dogs that are going into surgery, senior pain management, all of that is encompassed into rehabilitation. So what is interprofessional collaboration? Because that is sort of what we're talking about when we talk about shared care. That's all it is. Collaboration between professions. So veterinarians are really good at intra-professional collaboration, collaborating with their technicians, collaborating with each other, referrals to one another, but not necessarily, other than maybe more so in the large animal sector of things where we refer to farriers and things to help us out. It really doesn't happen very commonly. So with regards to rehabilitation, you're looking at physiotherapists, chiropractors, veterinarians, technicians, a little bit of massage therapists as well, all coming together and trying to figure out how to collaborate. So there are other players in the rehabilitation field, including, Bowen therapists and people who practice with magnets. We've got PEMF specialists. All of those people, there's a little bit less regulation with a lot of it. So they kind of stuck with the kind of major players in the professions involved, and that's kind of what we're going to stick with today. Okay. So why does this not happen commonly in veterinary medicine? There's a few reasons. In human medicine, and again, I'm speaking primarily in Ontario, but in human medicine, the public has direct access to professionals like chiropractors, physiotherapists. If I want to go to a chiropractor, I don't need a referral from my doctor. The only caveat to that is if I need a prescription for insurance purposes, then I do need to have that on file, but otherwise I can self-refer to these professions. And practitioners in the human health field have years of experience in education and training in their field. They're also really strictly regulated. So for example, and we'll kind of come up into rosters later, but physiotherapists are, strictly regulated. If they are on a roster for a specialty such as acupuncture, there are certain criteria that they have to meet in order to be included on that roster. And so they're very strictly regulated. And this is a little bit lacking in the field of animal rehabilitation. So the other thing is these certification programs are intensive. Any of us who have taken them know how much work they are while you're trying to practice and do your online stuff and go down for your practical stuff, do your case studies and your exams. And it takes a long time. I think I did mine over the course of a year, but it's also not all encompassing. These are great certification programs as an adjunct to what your knowledge base already is. So there's going to be gaps in every single profession that takes these courses, if that makes sense. And it becomes more obvious. It became more obvious to me as a veterinarian when I finished my certification and then went, okay, I have all of this knowledge. I still felt like I needed more. And that does come with time and it does come with experience, but it does make it so that if we collaborated and brought all of our experience from all of these different professions together, how much better this would be for patients. And that's pretty much what I just said about collaboration. Our education, our primary education and focus is anatomy, physiology, diagnosis, treatment of all of these different species. And we don't get training and education on myofascial palpation and movement and biomechanics. That's not something that happens. So if we have multiple teams, members of the team coming in from different fields, we can gain that much more knowledge and experience to bring to those patients. So, and again, an integrative approach gives them the best chance at success. So what could this potentially look like in veterinary medicine? Open communication. We need to be communicating with one another, whether that's physiotherapist talking to the veterinarian about what they've seen in their patient, whether it's the veterinarian talking to the physiotherapist or the chiropractor or the massage therapist, so that everybody is on the same page and has access to the same information. So ideally, in my ideal world, ideal scenario, this would include a veterinarian's exam. That veterinarian examines that patient from their perspective and rules out cardiovascular issues, metabolic, neoplastic, any other concerns that they can rule out prior to referring this patient to another professional. Diagnostics like x-rays and blood work and things like that are super helpful. They give us more pieces of that puzzle to make sure that we have enough information before sending them off to physiotherapy, right? So there's your puzzle. And even when I treat patients in general practice, you know, all of these things are a little tiny piece of that puzzle. So the more pieces we have, the better ability we're going to see that picture. Does anybody have any comments, questions? Jen, you don't see anything on Facebook? Interrupt me if you do. Okay, so one of the things that is happening in Ontario is changes to the Veterinarians Act. So I'll just kind of talk about what that is. Our Veterinarians Act provides our college, which is our regulatory body, the authority to develop bylaws and define its administration. And it also sets out minimum standards for all of the facilities that we practice at. And then it regulates the practice of veterinary medicine. It governs the veterinarians that are members, so to protect and serve the public interest. The last time this was updated was 1989. Like, let's let that sink in for a minute. 1989 is the last time the Veterinarians Act was updated with, this is what regulates us. There is nothing, right? Since then, think about how many things have changed in veterinary medicine that, you know, that is not even a thought in the Veterinarians Act. And this is why, one of the reasons it has come up. So because the college recognized that the public want direct access, they want access to all of these therapies, and there's no ability to regulate any of it because of the very, very ancient Veterinarians Act, they started making movements towards how they could make things safer so that they could say, yes, you want direct access rehabilitation, great, let's make sure that we do this in the safest way possible. So that is part of the reason a lot of these things are changing. And the Veterinarian Act changes, there's a lot of other things being involved we can kind of touch base on later. So what the CVO did after consulting with a lot of different groups was came up with a classification of energy. So again, the purpose was to allow open access to rehabilitation practitioners, other qualified practitioners too, like chiropractors, massage therapists, in the safest way possible. And we know, and the CVO knew, that physiotherapists and a lot of these other professionals have way more knowledge of laser therapy, shockwave therapy than general practitioners do. So the goal was never to remove those from their list of modalities that they can use, but how do we make sure that this is all being done in the safest way possible? So I'm not sure if you can click on links. I don't think you can in this presentation. So I'll make sure that I have that available, that we can put the links somewhere. But these are links to what they developed as far as position statements and policy statements regarding energy use. So I'm not going to read through all of this, but I just wanted to give you an idea. So they categorized energy, things like shockwave and laser and surgical lasers and TENS machines, anything like that, into high, moderate, and low risk. So high risk was considered things like surgical lasers, MRIs, diagnostic ultrasounds, and the high risk category is for veterinary use only, or delegation to an auxiliary that is working under that veterinarian. So those are the only individuals that can be allowed to use those items. And then they went into moderate, and these were more commonly used by other professionals other than veterinarians. So things like, especially in large animal, transabdominal ultrasound for pregnancy diagnosis, class 4 lasers are a big one. Radial shockwave was another big contender in this category. So they took those and they separated them into A and B in moderate risk. Both of these, they still said, are a veterinarian or an auxiliary under a veterinarian supervision. And the delegation part, they have a whole policy statement on delegation as well and what that involves. And that may be indirect or direct, up to the veterinarian's discretion. In the Part B category, it is also for referral from a veterinarian. So if you know that you have a physiotherapist that is amazing, she's amazing, she is amazing, that you're happy and confident that you want to refer all of your patients to, then they are allowed, based on this categorization, to be using those modalities. And then you have your third low risk category. This is where you have things like above the dermis procedures. So TENS machines, therapeutic ultrasound machines, people can buy these on Amazon. So they're using them anyways. They have them in their households. You can't control that. And so these were considered low risk. Anyone can use them, no concerns. I'm curious what people's thoughts are on this categorization. I know it was fairly controversial on social media up in Canada, so I'm not sure how everyone else is feeling, but these, if you have thoughts, I'd be happy to hear them. Okay, so next step was the college decided to form a working group, and in that working group was 2 veterinarians, 2 registered veterinary technicians, 2 chiropractors, and 2 physiotherapists, all of which practice some varying degrees of rehabilitation on animals. So these were the tasks that were laid out for this group. They wanted them to identify resources so that we could support the education of veterinarians on all of the different roles and experience and education that these other professionals go through to be able to practice on animals. They also wanted to talk about how to refer to non-veterinarians, because also within our current Veterinarians Act, it is not a thing. It is not a capability that even exists. And so we even talked about whether referral was the correct term, but they decided to stick with that. And then how do we actually refer to non-veterinary professionals safely? And then the pros and cons of various methods of rostering, and we go into rostering a little bit more in this talk, but that was one of the things that came up. How can we do it? Can we do it at all? And will it help facilitate that referral process? Okay, rosters. So what is a roster? It is essentially a list of practitioners qualified to practice a certain specialty. So not really seen in veterinary medicine. We have board certified individuals, and you can search those up on the college roster, or sorry, college page on their homepage on their site, but you can't search for someone who's certified in something. So we don't see that as much in veterinary medicine. They do use it a lot in other professions. And so what we wanted to do is maybe talk about rosters of individuals, of non-veterinarians that are qualified to provide these services. To help with animal safety, provide proper channels for information for the public as well as for referrals, maybe instill the veterinarians that want to refer, give them a trusted source of information, help facilitate those referrals, and allow the public to seek them out. It also was, we were hoping would encourage individuals maybe that weren't certified or didn't have those specialties, or maybe weren't registered. So that's something we haven't talked about because it's an international group. You may not be aware, but in Ontario specifically, there are technicians, they do not have to be registered to practice within a veterinary clinic. Every time I have this conversation, people in the States are like, what? So they can go to school and they can take their, graduate from their technician college. They may take the exam and become a member of their organization, but they don't have to. Clinics don't make it mandatory. There's a lot of lack of support from veterinarians. I've seen veterinarians go, well, you don't really get anything out of it, so just leave it. Don't bother with your exam. But then again, there's a lack of regulation there if that happens as well. It's just very inconsistent. So we're hoping, I think there's a hope that if we have rosters of individuals and one of the criteria is that they are registered, then maybe it will encourage that more people to get registered with the college. I hope that makes sense. Okay, so within our committee, all of us had to lay out the education requirements in order to become certified in rehab, you know, what that course of education looked like, how many training hours, the exams, etc. And then develop requirements for individuals to be included on these rosters. So, you know, would they have to be licensed? Could they be retired and not licensed? What is their criteria to remove them from a roster? And what is the criteria to stay on the roster? Those were all really important things. And whether or not they needed malpractice insurance. So I didn't put all of them up here because all the professions had everybody putting input, but I just kind of put two general ones together here. This one was from the technicians and I kind of merged the two together. So their thought was they needed to have their vet tech degree and a rehab certification from one of the recognized certification programs. Ideally, some clinical experience if they're operating on their own and they're operating their own business. Registration exam had to be done and they had to be up to date on their payments with the OAVT, so the Ontario Association of Veterinary Technicians, and in good standing. They wanted continuing education credits, at least focusing on rehab, 10 credits, you know, every 1 to 2 years. Malpractice insurance they can get through the OAVT, and no complaints. So if they had any complaints with the college, they hadn't paid their dues, lack of CE completion, and then they would be removed from the roster. Chiropractors, again, they were like trying to figure out who would actually manage the roster. So whether it would be the CCO or the OCA, the education had to be a minimum 3-year degree. They had to be a qualified chiropractor, and then they had a whole bunch of standards, as you can see, that they put in there. And their own act dictates a lot of that as well. So they kind of referred to that. Same thing with define, you know, how much clinical experience. Well, that's defined in their certification programs. They had to be in good standing with their college, with an animal rider on their insurance policy. And then again, removal from the roster would be loss or suspension of their license and loss of their animal coverage. So this is what it was challenging, to say the least, because the question was, how do we actually go about rostering these individuals? It's one thing just to make a list of them. How do we actually roster them and let everybody know? And within each profession, who's gonna monitor these rosters? You know, is going to be the CCO or the OCA for chiropractors. Veterinarians, we talked about the OVMA, trying to reach out to them. That's our Ontario kind of organization for veterinarians. They are not a regulatory body, but they do a lot of work for veterinarians. And would they roster this list for us, or maintain this roster? And then could veterinarians even be rostered at all? Okay. So we finished those things. It was, you know, in about a year. And then the council for our college came back and said, great work, keep going. So a phase 2 came about. And there was a lot more tasks involved with this phase of the group. So we had to develop a joint message amongst all the professions to circulate. And I will share that with you today. And the focus was safe collaborative care. How can we identify that? And how can the public identify that? And the CVO was going to develop a position statement on the importance of collaborative care in animal rehabilitation, at the same time balancing public choice and their ability to want direct access. They also wanted to ensure the college's public register was easily searchable in relation to veterinarians practicing in animal rehab. So again, you could have an interest in rehab that doesn't necessarily you're certified or qualified to be doing those things and practicing within your scope. So they were trying to figure out how they could change the public register to make that easier for the public to search. And develop and promote online rosters. So we were still working on the rosters. Okay. They also want us to create some statements on expected standards for non-veterinary professionals practicing animal rehab, and create and promote educational materials related to the differences between those. And so, if you go to a veterinarian versus a certified rostered individual versus someone who is not certified or rostered and is still practicing, what is the difference between those things? And educational materials related to the benefits of animal rehabilitation, because there's still a lot of veterinarians and professionals out there who do not believe that it's a little woo-woo for them, right? It's not, just saying, but but there's a lot of people who believe that still. And it's not being taught up here anyways. The Ontario Veterinary College, it's really not a focus of their education for their vet students. And to develop resources to assist vets in understanding and differentiating their roles with liability, because that's a big thing. I know this was a concern when I was in general practice. If my client took their dog, their cat, their bunny, their goat, whatever, to a non-veterinarian and something went wrong, it was my liability. And so I know that was still a concern. And so we were trying to also develop resources to support veterinarians and educate them on that. And then to promote and encourage the public and the profession based on educational and networking opportunities. So, which is why I'm talking to you today. It's why I talked at the conference about a week and a half ago, just trying to share this information with everybody. Okay. So these are the infographics that they came up with between all of the professions. And this is the first one. So, let me know what you think. Please feel free to throw something in the chat on your ideas. This is for the public to say, okay, so here are your options. Door one is your veterinarian. This is what you get when you go in to see your veterinarian. You have full regulatory oversight. You have direct access to any treatment as long as it's within their scope of practice. You have proof of training, because we have to document that and have that visible, and published standards of practice. If you go to the next door, we've referred you off to a certified animal rehab professional, whether that's a technician, a physiotherapist, a chiropractor. You have direct access to them as well. The regulatory oversight is profession specific. Some have more regulation than others, but they do have to have proof of training and knowledge in animal rehabilitation and profession specific standards of practice. So it depends on the profession what that looks like. And then you have the others, and that's what we were talking about before. There is no regulatory oversight. So if something goes wrong, there's no one to take their license away because there is no license. They still have direct access. So the goal is to try and steer might be the wrong word, encourage clients to make wise decisions that are safe for their animals and choose professionals that are regulated that may provide safe rehabilitation for their pets. And this is what we came up with for veterinarians. So talking about why collaboration is important for positive outcomes, encouraging sharing of medical records and having conversations with each other and one another, for safe and competent care, to enhance patient function, and education of each other, education of clients. In general practice, how often do GPs have the opportunity to sit on the floor for half an hour to an hour and just talk about home environment and home care and exercises and their capabilities and expectations? It's it's busy in general practice right now, and rehab is a lot about education of clients and education on diseases and their disease state, whether that's a cruciate tear or hip dysplasia, and expectations, all of that. And so again, please let me know what your thoughts are on this as well. And then finally, benefits of collaboration. You know, even a couple weeks ago, I had a client come in and she's like, I'm really happy we got in off the wait list. But I was very confused. I was confused why you needed a referral and medical records from my veterinarian. You are a veterinarian. And I'm like, yeah. And even in general practice, every time I saw a patient coming in for the first time, the first thing I wanted was those medical records. Because there's sometimes things that get forgotten by clients or misunderstood by clients. The number of times I cartrophin and carprofen mixed up as far as what they're telling me these animals are on, medical records give me all of that information. So I explained to her why, and then she understood, but we're trying to encourage clients because they're out there and they're like, I don't want you to talk to my veterinarian because I don't want they don't want those medical records transferred. And so we need to let them know how important it is to share information. All right, so continued challenges, you know, the goal of these rosters again was to help guide veterinarians. So if you knew that your client was looking for a physiotherapist, they wanted to go see a physiotherapist, they've been seeing this person, and you had feelings that maybe they weren't qualified, you could quickly refer to these rosters and be able to check. Same thing with any of the other professions. The challenges were that these organizations, you know, are still trying to work on how to make this happen, but they are working through it. The other challenge was each one of these professions had sort of different ideas on what would be required to be on the roster. Some felt licensing was mandatory and others did not think, you know, they thought retired, you know, individuals who maybe haven't kept their license up should be allowed to be on the roster. So that is still being sorted out. And the CVO is still working towards how to make this a little bit more searchable online for veterinarians. So what's left to do? Finish the rosters. And then updating the Veterinarians Act of Ontario. So hopefully when it's finalized and published, you know, the scope of what veterinary medicine is will be a little bit more clear to the public, to veterinarians, to other professionals. There's other things coming up now, including, you know, acupuncture below the dermis procedures and who's going to be allowed to practice that as well, for safety reasons. And then because animal rehab is still considered low risk by the CBO, direct access is okay in their opinion. It is not considered veterinary medicine only. And so we're encouraging all of these professions to collaborate and share medical records. So one of the things that the Veterinarians Act is changing considered veterinary medicine. They had already, so what happened is the college drafted what they wanted to change and add, including who makes up council. The other thing they want to do is merge the Ontario Association of Veterinary Technicians, the OAVT, with the College of Veterinarians, so that this new organization would regulate all of them together, giving technicians a little bit more autonomy in their profession, which I think is amazing. And it also is making their terms of technician, registered veterinary technician, there's a couple others in there, cannot be used unless they are licensed and registered with this organization. There's things including how to prescribe and who can dispense medications. There's a lot on there. And so they did submit it to the Ontario Ministry of Food and Rural Affairs, OMAFRA, and they sent it out to the public for their opinions. So now that has all been done. They have a discussion paper based on the feedback that they got and are looking for further input from the public, veterinarians, technicians, anybody. I encourage you to go and read it, so you're aware of some of the changes that are happening and give your input. I think that's the only way we can make changes and make things happen. So I did put the email there as far as submitting your opinions on things. So in summary, owners want access to a lot of different treatment options for their pets. And safe collaborative care is possible. It should include sharing of medical records, and that goes both ways, as well as collaboration between professionals. And we really need to educate our clients and guide them into making safe, good life decisions for their pets. And change is possible. It takes time. I think they've been working on this since 2017, but it definitely is possible. So that's all I have. I don't know if there's questions, Jen, or anybody.
Danielle, it's Jen. I think the biggest thing is the reluctance because veterinarians feel like they're trying to guard their expertise in some ways, or their presumed expertise. Do you think that's where some reluctance might come in?
Maybe. I mean, I think for me, before I ever did rehab, it wasn't about that, but it made you feel icky. Like it made you feel like they're like, oh yeah, I went and talked to like an animal communicator and they think this, and I went to the Bowen person and they think this, and then I'm getting acupuncture over here and I'm getting massage, and you're like there's no input to say, hey, just so you know, this dog had like cancer removed in that spot that you've been lasering, or hey, this dog has gulp and we're worried about it going in, or can we make sure, you know, that, because maybe they don't know that, and owners aren't always good at communicating that, especially if diagnostics haven't been done. So I think for me, and I can't speak for every other veterinarian, but for me, it was about not knowing and making sure that they were safe. It was also about liability, because we were told, and this is going back a while, but we were told at the time, if I send them and go, yeah, it's okay, you can go to this place, they have a pool, and that dog gets aspiration pneumonia, I was on the hook because they don't have a license, but I would be liable. Something went wrong. And so I think those things are starting to change, you know, but I don't think it's about control. Maybe in saying that, maybe sometimes it is. But I think I think it's a liability thing. So when I talk to veterinarians who refer to us, they have chosen us because I am a veterinarian. So they know that if it comes to me, they are not liable. I have my own liability in regards to the college, and I'm being regulated. So I think their hesitancy to refer other places is that.
More related to that. Yeah, that makes sense. I guess the other big thing is what's still happening, and this is all the bureaucratic red tape, is who's going to be in charge of all this, you know, like where does the buck stop exactly, right?
Yeah. And the concern that came up when we were at the conference was, great, this is great, so you do all of these things and you're like, you know, we're going to regulate these people. They're like, okay, so if you say, let's just use acupuncture as an example, if you say only veterinarians are allowed to do acupuncture, who is going to regulate that? Because if, let's say, hundreds of non-veterinarians are doing it, I'm just throwing numbers out there, the college does not have time to go around and monitor all those other places. They're not veterinarians. That's not their job. The only way that anything ever gets shut down is if there's a complaint against that person, and then they get like a warning, a fine, and like a cease and desist. If they keep doing it, then maybe they can try and shut them down. But I guess that was the concern that came up, is like, great, it's great on paper, but that's only great if people actually follow the rules that are laid out.
Right, exactly. And I think everybody agrees that you want the best rehabilitation medicine for your patient, and if that best is not a veterinarian, that's wonderful, but it also needs to be somebody that has some type of liability or skin in the game. You know, they can't just put a shingle out, right? You know.
Yeah, agreed. Yeah.
Mhm.
Mhm.
It's a great topic, and it's a lot. I mean, I think it's really timely because of what's going on with credentialing of veterinary technicians and protecting licensed versus not licensed. So it's the whole issue altogether is, how are we going to get this accomplished?
Yeah, exactly. And so it sounds like the next couple months, the discussion paper and the feedback will go back again, and then I suspect it will be finalized this year, the new Vet Act. So we'll see what it says.
Well, it's wonderful, and we're really excited to have you as an opinion person on this, and it was really great that you were invited to be part of this group too. So you can keep us all posted on what ends up happening in Ontario.
Yes, absolutely. Well, and I think that's why in Canada anyways, it's affected multiple provinces, because they're like, whoa, if it's happening in Ontario, it's not going to take long for all the other provinces to go, oh, what did they do? Hey, maybe we should look at that as well. So
Right. Well, it's excellent. Thank you so much for spending the time with us today, and it was wonderful having you. And I know if there's questions at other times, you might be getting some emails from us. Everybody can reach out to the IVAPM, go on our website, or go at info@ivapm.org and send your questions in or your thoughts about this, or post them on our Facebook, the live stream. And thanks so much, Danielle.
thank you for having me.
All right. Have a great one. Take care.
Yes, you too.
Bye-bye.